I would again like to call upon the stage chairperson for the next session on cochlear implant, Dr. M.M. Patil, Dr. Shishir Gosavi, Dr. Shyam Somani, and Dr. Sapna Parab. I would like to call upon stage Dr. Hetal Mafatia ma'am to moderate the session. I would like to call upon stage, we would like to start expert talks. I would like to call upon stage Dr. Pradeep Uppal sir to give his lecture on how to start and sustain cochlear implant program in private practice, our experience.
Dr. Pradeep Uppal is a cochlear implant surgeon from Mumbai, Thane, and he has excellent series and a very good experience, a good orator. I welcome him. आपका नीचे है? इसमें? ये है ना?
बघ ना फर्स्ट स्लाइड घेऊन ये. काय चालू करू याला खाली कर ना. अरे मला दिसायला नको. अरे हे चालू कर ना. काय झालं फर्स्ट स्लाइड घेऊन करेक्ट येतात पण काय एक मिनिट करू का बस ओके. Good afternoon everyone. At the onset would like to thank the organizers. Thank you everyone. In fact, Prasad specifically called me up and told me that we want to know how you started the implant. Please tell us how anybody can. Kya is it? Mic varti karu? Okay, is it okay? Thank you. He specifically told me to tell how you started. No need to be we don't want any technical details. We want mainly practically how you started. And I'll tell you exactly how I started and how you as a junior person can start a cochlear implant program. Suppose there's a person who passed his MS or is practicing since last 5 years and one fine day he decides, no, I want to start cochlear implant. The basic requirement is you should have patience, you should have competence and skill, you should try to have finance because these type of surgeries require a lot of money. At the end of the session, I'll give you all the list of places from where your patient can get finance. And last and most important is team. Let's pick up each point separately and how did we proceed and how you can proceed. What I have done, not necessarily that is the only way to go ahead, but I am sharing my perspective as per Prasad's request. If you want patient, just doing your routine ENT practice, you have to create awareness in the society that you are doing cochlear implant. One, you can put awareness posters in a, 1 minute, I'll take a laser pointer. Yeah. You can create posters in your waiting room so people can see. But again, it is too limited an exposure. You can solicit patient from your medical fraternity, especially pediatrician and general practitioner. If you're starting your practice, don't waste time on ENT surgeon. No ENT surgeon will happily send you a patient in early stage of your practice because you have not done any implant. Till you do 20, 30, don't waste your energy on ENT and audiologist. Speak to pediatrician, speak to GP. But why should pediatrician listen to you for your cochlear implant? He's not interested in cochlear implant. So you should tell him, I'm talking on pediatric in ENT in pediatric practice, ENT in day-to-day practice, where you tell them about epistaxis, ear pain, and then you tell, look, I am doing a cochlear implant. This is how they will listen to you. Social media, I'm not good at it. I've never been on Facebook or Instagram, but my friends, they say it's a fantastic. I have no experience. Print media has helped me quite a lot. I will talk to you a little later on. In 2009, we have done a first cochlear implant in Thane. But in 2008, I bought a first OE Bera machine. So it took 15 months for me to get a first patient. In this 15 months, I tried everything what I told you. I put the posters in my waiting room. I went to pediatricians, went to Rotary Club, spoke everywhere. And after 15 months, we did a first cochlear implant. Now this lake also came because reporter was in a waiting room. He saw and then he asked me, and this is how it went. Now if you think, when I did my first cochlear implant, try to teleport yourself in 2009. Today there's a lot of awareness. In every conference there's a cochlear implant. That time, very, very few people were doing. According to me, I remember only Kirtanes sir was doing, and previously maybe Sandra madam was doing. Otherwise, I didn't know anybody was doing cochlear implant. Today we have done 300 plus implant, and there was no financial support. My first 80 patient, everyone paid from their pocket. That time the cost was 5.8, 5.38 or something. And first 100 we did in Dr. Uppal ENT hospital. Let's think logically. A patient knows that Dr. Uppal has a 2-bed hospital. He's never done an implant before. And Mecca of cochlear implant was just 20 kilometers and 20 minutes away from our hospital. And GOAT, greatest of all time, Dr. Kirtane, was at 20 kilometers. So why should anybody come to me for surgery? Think of it. So we had our own nursing home. We offered a free surgery to the patient. We have to offer something. Otherwise, there's no reason patient should come to me. We requested a pharma company to help the poor patient. Believe me, it was ethical, it was legal, where Dr. Uppal was not involved. If somebody is interested, I'll give you the detailed format, how the pharma company can help. I told them, help 5 patients, they helped 25 patients. Because they were so happy, their money was going from CSR, they are doing good work, and they are getting in return what they want from me. So, requested Dr. Milind Kirtane sir, and he was great, and I'll be always grateful to you. Sir, without you, I would not have been standing here. So, second most important thing is, even if you get a patient, do you have a skill? You need a competence. I'd passed my MS from Sion Hospital, and within 3 months I started my practice for financial and my personal reason. All this gold medal and scholastic credential, best paper award, best thesis award, I was on 9th cloud. But all these were useless as far as developing your skill is concerned. For your skill, you need to do dissection. Only dissection. And radiology. Radiology was very important because your radiologist doesn't know how to read the CT scan. So I used to go, before every surgery, I used to take this what is there in my hand is a dissected temporal bone where I have done a posterior tympanotomy. I used to sit with the radiologist and say, nerve kute, cochlea kute, basal turn kute, and I used to learn from them. Cases were far and few. One case, after 4 months, there's another case. So by that time, you have lost all the confidence. So this is not one of the most legal thing I'd ever done. I have smuggled the head from the department to my hospital, where Sugato is with me. Saturday night, we brought the head, we dissected. Monday morning, we did the other ear. And before Monday morning, before the department opens, we delivered the head. I'm not saying you should do that, but this is what Prasad told me. You tell me what you did, and I did it. So I tried to maintain my confidence by doing all this dissection. And thanks to Minish encouraged me. Best way of teaching, best way of learning is teaching. Since last 4 years, every 6 months we conduct a workshop, and I'm thankful to Jupiter Hospital who had given me full operation theatre. Nobody can believe we do all this dissection in a proper OT setup. We take regular lectures for audiologists. You may call it awareness, marketing, soliciting, whatever you say, but we keep taking these regular lectures for the audiologist, for the pediatrician. In fact, pediatrician, so every 6 months, every 3 months, I take. Given a choice, if somebody tells me MENTCON, there is an invitation, and PEDICON, there is an invitation, that is pediatric conference, I'll prefer PEDICON. Because they are really, I'm getting a patient more. Now, cases were genuinely far and few. I had no work to do. I visited this renowned name, and each one of them, really I learned something from them. I will request everyone, by seeing a YouTube video, you can never become an accomplished surgeon. You will learn the technique, But go to Sir's hospital, hospital where he's operating. Go to Hetal, go to Minish. What happens when you see them, their body language, how they think, what they do, that also is very important. If you see my graph, there was no implant, were very less, and suddenly it shot up. Why it shot up? Because this gentleman came into my career or whatever. He was a municipal commissioner of Thane. And we signed an MOU. It was a history that MOU was signed between Dr. Uppal Nursing Home and Thane Municipal Corporation, where every patient was given 2.5 lakh rupees. People ask me, how do you ask money? I never asked money. And I tell you, if you know the bureaucrat, never ever ask them money. You start your talk with something different. Try to talk that you are helping them. Sir, आपल्या कॉन्स्टिट्युएन्सीमध्ये खूप मूकबधीर मुलं आहे, आपण काहीतरी करायला पाहिजे. Never use the word money, and once your rapport develop, then you can talk. So he signed an MOU, and we have started getting a lot of patients. And end of the day, what do they want? Even they want their biodata to be better. They want to show their bosses that they are doing good work. So as soon as the first implant was done with the TMC, the mayor of the city and commissioner came to my small clinic. They got a photographer and press and everyone, and they took a picture. And if you are doing good work, don't feel shy to show. Show your results, show to the people. And here, there are a lot of philanthropists who helped us, and Niranjan Hirandani helping us a bit too much because he has his own hospital, his own CI program. He really supported us, and I'm thankful to him. Then, as I've told you, the print media was behind us, not we were after him. They gave us a good coverage. We got a lot of acknowledgement and recognition from the society, from social organization, but the biggest satisfaction and you really felt great was, this was in 2010, we have done a surgery for her. She's sitting in my consulting room with a remote. In 2022, she got 98% in 10th standard. That means CBSE board competing with the normal children. What more you want? And nothing, not less, 2024, she got into IIT Bombay Mechanical. I was happy as when my both children got into Bombay IIT with a very good rank. And I'm little extra happy. My elder son, who teaches physics for IIT only, he doesn't take NEET, only physics, he also helped in her whenever she had a doubt. So it was double satisfaction. Now the twist came in 2018, I was invited by the Jupiter Hospital. What is this bell? No. In 2018, I was invited by the Jupiter Hospital. Then everybody said, what will happen to your CI program and whatever the MOU? I took in writing from them that my CI program, you're not going to touch it. It will be Dr. Uppal's CI program. They went out of the way. They said, forget it. We are ready to all investigation, CT, MRI free. Everything was done free. They, in fact, took a pride in having a cochlear implant program, and they initiated the Deafness Mukt Thane and everything. Our ex-chief minister was there, and it was going very well. I was very lucky. On the one hand, the management was with me. On the one hand, the corporation had a full faith in me. So I told them, let's do the work together. Why say private? Why say public? And we have a public-private partnership where every nursing home of a Thane was adopted by our ENT department. We did the screening. We did all this thing. And then we did whatever surgeries. We were happy, a lot of work were going on. I got 312 such pictures. Every picture after the surgery, we take a picture for a record. We were happy but sad because they were coming late. Average age was 3.5 years we were operating. Luckily for me, this member of parliament, Dr. Shrikant Shinde, came with some problem. Again, I never asked for money. I told him, sir, आपण इतका मेहनत करतोय, पैसे लावतो, पण result येत नाही. Immediately he called all the commissioners, collectors from Thane. He donated six OE machine, and we started a new what is called as a SOP. That means every patient will get a cochlear implant free by Thane Municipal Corporation. Thane Municipal Corporation will give 4.5 lakh rupees for second cochlear implant, and then team is very important. Without them, we cannot help it. Such ups and downs comes in life, especially in the case of cochlear implant, where we need a very good unwinding system. And for me, the most unwinding is playing with my grandchildren. Thanks to Sugato, Kamal and Amol, and big thanks to Kirtane sir, without whom I would not have started the program. But sir came only 3 times. And third time he inspired, he gave me so much confidence. He said, आता माझी गरज नाही, काय लागलं तर फोन कर, भिऊ नकोस, मी तुझ्या पाठीशी. Thank you, sir.
Thank you so much, sir.